On today's video, I'm going to concentrate on lengthening the hip flexor with a few of my favorite moves. Welcome back, everybody. I'm Burke with Focus Physical Therapy, and today we are all about hip flexors. So the hip flexor are two muscles that are very important in the function of not just the hip, but the pelvis and lumbar spine, and here's why. That muscle actually attaches to these transverse processes right here on the spine, and it passes through the pelvis, essentially covering the sacroiliac joints here before attaching into the trochanter of the femur. Now, because this hip flexor actually crosses a number of different joints, it has actions on all of those joints. For the hip, the main action is flexion of the hip. And for the sacroiliac joint, as well as the lumbar spine, this muscle is a stabilizer. So imagine that you're standing. Your hip joint may not be moving around very much in space, but on top of that hip joint, your pelvis can do all kinds of movements. It can tip forward, it can rotate, it can side bend, it can do a number of different things. And all of those motions are stabilized by the muscles around the hip and pelvis. Not to mention that once this pelvis starts to move, that's going to affect what happens here in the lumbar spine. So thinking about any muscle as being 2 points of attachment that shorten and lengthen, here's our hip flexor. What happens when this muscle shortens? It's going to either move the leg, but if the leg is planted, if the foot is planted and the leg doesn't move, what happens next is that these points along the transverse processes of the spine are going to get closer to the hip. And as that happens, you get some compression of the low back, and you'll also get a forward tilt of the pelvis. Now, this matters for two important reasons. One, anytime we're shifting our body away from a dynamic neutral position where we have the freedom to move in any direction in space, as soon as we begin to shift off of that dynamic neutral position, some muscles are going to win and some are going to lose. It becomes a little bit of a balancing act across different muscle groups. And in this particular instance, as soon as the pelvis starts to tilt forward, as soon as the lumbar spine starts to exaggerate the lordosis or the arch of the low back, then the other muscles that oppose those actions, specifically the lower abdominals and the glutes, they are biased towards a weakened position, and that is not good for anybody. The other reason this can be a problem is because as we tip away from that dynamic neutral, we're getting towards the end of our joint range of motion. And some joints, in fact, including the facet joints of the lumbar spine here, can actually become stressed. They can become overly compressed. The SI joints, those sacroiliac joints I mentioned, which you can see right here, imagine that the hip flexor is tight and I'm walking. What happens is, as one leg goes behind me, my hip flexor prevents that femur from traveling behind me as far as it needs to. And so the next joint up the kinetic chain, the SI joint or sacroiliac joint, has to accommodate for that. And you begin to see all kinds of torsion-related problems in the SI joints that can be traced back to hip flexor dysfunction. So the good news, like any muscle dysfunction, you can treat this. You can do things about it. You can work to lengthen your hip flexor. You can work to strengthen those antagonistic muscles, the lower abdominals and the glutes. On today's video, I'm going to concentrate on lengthening the hip flexor with a few of my favorite moves. Let's go ahead and roll out a mat and get started. Now we're going to take these in the order in which I typically instruct them, starting with the lightest amount of force, progressing to the most amount of force. And the reason for that is sometimes that muscle is irritable, sometimes those joints are irritable. Think about it this way: as soon as you start to stretch a muscle, you're taking those two attachment points and you are separating them. Now, while you're separating them, you're increasing the tension in that muscle, at least temporarily. And that increased tension can lead to compression of the joints that muscle crosses. So our first stretch today is actually a movement. It's intended to neurologically prepare that muscle to lengthen before we get into some of our other stretches. So let me show you what that looks like right now. This first exercise is called a knee lean and lengthen, and it works just like it sounds. Starting on your back, let your knee drop to the outside, tilting your pelvis with it. And when you get to the outer edge of your foot and your knee gets as close to the floor as it's going to go, press your leg away from you, keeping it rotated open until you get to the end of your motion and your foot starts to center towards the ceiling. It won't go all the way. Reverse it in the same way. Roll your foot to the outside edge. Start to bend your knee. Pull that up, and as you pull it up, let your pelvis rotate. And when you get to the end of that motion and your knee starts to lift away, pull it up all the way until your knee is standing again. So if I do a couple in a row, it'll look like this. Our next exercise is a side-lying hip flexor stretch. Here's how it works. Laying on your side, bend your bottom leg up close to 90 degrees if you can. Support your head with your hand or use a pillow. With your top hand, take a hold of your left ankle and foot. Bring that in tight and start to pull back until you begin to feel the stretch. Now this angle here, the more I bring my heel in, the more I will initially feel the stretch in my quad. And as I extend my hip, I'll feel it in my rectus femoris, the long muscle that attaches on my pelvis and then down below my knee. And as I do this, if I open my knee angle, then the stretch will shift up. Now I'm a little tight in my hip flexors, and so ideally this would have more freedom to travel behind me. That's why I have this foam roller. If I put the foam roller behind me, I can rest my foot on that, and then I can press my hip back. And as I do that, my knee joint angle opens, and I'm getting more of a stretch right up here through my hip flexor. I'm going to just cue some stability here in my pelvis so that I'm not arching my back. This is very important when you're doing these hip flexor stretches. That tightness in that hip flexor is going to make your back want to arch, and we don't want that to happen. You'll notice that my knees dropped a little bit, and that's important. There are other structures here that are often associated with this and are tight, including some muscles up here on the outside of the pelvis. And if I let this come open like this, then I may be completely missing some other areas of tightness. So you can take your hip through a range of rotations to see what feels best. Some knee discomfort is possible with this because it does stretch the fascia around the knee, so just be aware of that. So this is a side-lying hip flexor stretch, and it's active. I'm going to do these slow pulses with breath, and then I'm going to get to a point where I'm just going to hold it. You can brace your other foot against this to make a little prop for yourself, and right now I'm getting a nice deep stretch right up through there. Our next one is going to be a little bit more familiar. This is a half kneeling hip flexor stretch. I'm going to get into this lunge position with my hands on my pelvis, I'm going to tilt my pelvis backwards as if I was tucking a tail underneath myself. And immediately, because I'm a little tight as I demonstrated before, I can start to feel that right up there in my hip flexor as well as in my quad. If that's not enough, I can, holding this position, begin to press my hip forward into it, and that will increase the stretch. The other thing I want to point out is this rotation here is significant. That hip flexor rolls a little bit to the inside of the femur. And so if I really want to get this, I'll push my foot a little bit out that way. And then that is really targeted. Actually feels really good, although it's a little bit intense. And the other thing I can do, because of the upper attachment of the hip flexor on my lumbar spine, on those vertebrae, I can take those transverse processes and lift them to the ceiling. And oh, that is a really nice deep stretch right in there. So that is really good and deep for the hip flexor. Okay, the last version I'm going to show you uses a chair. And the way this one works is we're going to prop our back foot on the chair, hop our front foot forward a little bit, and then begin to drop the pelvis. Now right there, that's pretty intense, right through my quad and hip. I can add the same upper attachment lengthening. And then I can take the stretch off by pressing up to standing. So folks, there you have it. If you suspect that hip flexor dysfunction is part of your sacroiliac or lumbar spine problem, I recommend you incorporate these into a daily program for at least 2 or 3 weeks just to test that out. Start with the easy ones, do those 3 or 4 days in a row. If those are going well, progress to the next level. Feel free to experiment, change your angles of your joints, explore how your body moves. You might feel a more intense sensation, but it should not be painful, and it shouldn't provoke your familiar pain if it's sacroiliac, if it's lumbar, if it's in your hip. If it does, don't do these until you get yourself evaluated. So thanks so much for watching. If you haven't already, please hit that subscribe button. It really helps the channel a lot, and I hope to see you next time.